My name is Eileen Boris, and I'm the Hull Professor of Feminist Studies and a Professor of History, Black Studies, and Global Studies at the University of California, Santa Barbara. With Jennifer Klein of Yale, I've written the prize-winning history, Caring for America, Home Health Workers in the Shadow of the Welfare State. I come to you with pleasure, and it's a real pleasure, but also a privilege to have this opportunity to address the esteemed jurors, but also to talk with you, the people who make the work of the world possible. Thank you. I come to you to explain how law and social policy, both in Washington and in Sacramento, have turned care work into a low-wage job, naturalized not only as women's work, but as bad work, appropriate for poor women, particularly African American and immigrant women. But workers and consumers of home care, along with their allies, always have fought back. History helps us to understand that stigma, disrespect, low wages, and stolen time are not inherent to domestic and care work, but rather such qualities are legacies of slavery, Jim Crow, and limited notions of women's proper place, in which some more privileged people have benefited from the need for care that is, after all, the human condition. The exclusion of domestic and household work from the Fair Labor Standards Act of 1938, that is the FLSA, occurred in the wake of the New Deal relief programs that sent unemployed domestic workers, mostly African Americans, out as visiting housekeepers to care for children and then for elderly people and people with disabilities who were pushed out of institutions to save money, not for other reasons at that time. The home location of such labor justified exclusion of cleaners and caregivers from workplace rights. A man's home was considered his castle, and such reasoning separated the public from the private, even when the home became a workplace. The New Deal stopped in front of the family's door, placing household employees and agricultural laborers, jobs overrepresented by African Americans and immigrants of color, outside the law. Following World War II, both public welfare and health departments and nonprofit social and child welfare agencies, often religiously based, established home care services to maintain in the community those adults who required assistance, rather than warehousing them in more expensive institutions and hospitals. These jobs were to be good staff positions with training and career ladders, benefits, and social and civil service-like guarantees. But in the 1960s, with the greater prestige and more fulsome funding of medical models of care, we begin to have a job that becomes more casualized. And poor women who were on public assistance are pushed into these jobs, supposedly to make them independent, but really they became dependent on a low-wage labor market. Meanwhile, organized labor was demanding expanded wage and hour coverage. In 1966, care workers gained recognition under the Fair Labor Standards Act if they labored in an institutional setting, like a hospital. At the same time, those employed by what were called enterprises, that is businesses that earned a certain amount a year, at that time was $500,000, were subject to the law. And actually in the early 1970s, the Department of Labor won settlements against home care agencies, precisely the kind of third-party employers today contesting overtime provisions. In 1968, a divided California Industrial Welfare Commission that had been established in 1913 to extend labor standards to women workers first sought to include domestics. But business members protested this move as neither practical nor desirable and questioned whether inspectors could enter private homes to determine compliance. About the same time in 1972, IHSS developed, at the time as a welfare and health providing program in which the focus was on the recipient or the consumer rather than the provider of care. It came out of a contest led by the independent living movement, the disability rights movement of that day, and their contest against Ronald Reagan to implement federal disability programs. But at the same time, domestic workers under the banner of the Household Technicians of America were on the march, demanding recognition and decent treatment as part of a larger civil rights struggle. In 1974, most domestic workers won minimum wage and overtime coverage under FLSA, but not live-in workers. There is no doubt that the intent of Congress was to continue its expansion of the FLSA. That is what happened next. The exclusion of previously covered home care employees of agencies remains so puzzling. It is clear that the formulators of the 1974 amendments were not thinking of a huge for-profit industry when they excluded elder companions from the labor law. They were not speaking, as one put it, about the professional domestic who does this as a daily living, but rather about a neighbor who comes in and sits with an infirm or aged person. As the Maine senator who was shepherding the bill through Congress put it, companion, as we mean it, is to be there and to watch an older person, not perform housework. That is, the companion was to be an elder sitter akin to a babysitter. The babysitter, though, was the teenage girl next door, not a family breadwinner who needed higher wages to support others. So, too, the elder sitter was to be a part-time worker. But some childminders were workers, and so the managers of the bill added casual to clarify the distinction between the teenage babysitter and the family breadwinner. In making the rules to implement the 1974 amendments, the U.S. Department of Labor decided in its final deliberation to extend the companionship exemption to all domestic workers, whether hired by individuals or enterprises. California, 2 years later, in 1976, when it created its Wage Order 15 for employees in household occupations, provided a floor on wages and many other regulations, but like the amended FLSA, it encompasses only domestics at the time who primarily did housework, but classified personal attendants and others who cared for people as ineligible for its protections. IHSS existed as a separate part of the state code, though some provisions like minimum wage applied. By the early 1980s, home care unionizing had taken off. The founders of UDWA hoped for a membership that would include private household workers, hotel maids, and nursing home workers, but discovered their calling in organizing the home attendants paid by county welfare departments, which, as in San Diego, its home, and elsewhere, were contracting out this workforce to private homemaker corporations. UDWA built a multiracial union of African Americans, Mexican Americans, immigrant women of color, white women, along with some men. The various home care unions began organizing drives that showed women as the new face of labor, as hundreds of thousands of homemaids and attendants became unionized, both those who worked for agencies and those who worked for individuals, not only with UDW, but SEIU, and in some places, CWA. There was great creative innovation to figure out how to cover workers jointly employed by individuals and governments. Some of these innovations are being readjusted today in light of a hostile Supreme Court. As unions have fought back the conservative fiscal tide since the Great Recession of 2008 and have played defensive against well-oiled anti-union forces, a new domestic workers movement has been developing of immigrant women of color joined to an older tradition of African-American organizing. California's Bill of Rights, passed in 2013, thanks to that movement. And Governor Brown signed the act. Woo! He signed the act right after the Obama administration, only like a week or so later, announced final rules revising the so-called companionship exemption for personal care workers that had become so out of date in today's home care industry, one of the fastest growing in the nation. And indeed, if I had more time, I would argue that it was the companionship exemption along with some Reagan administration changes in the early 80s that fueled that $87 billion industry. The Bill of Rights promises to bring even more household workers under overtime protection. However, excluded in the final bill were IHSS workers. The thought was that they would be covered by the new federal regulation of care work under FLSA. As 2015 approached, we thought that the 40 years in the wilderness had ended. California had enacted last June a bill that committed the state to implementing overtime for IHSS workers, even if the federal change was delayed. Then D.C. District Judge Richard A. Leon, a George W. Bush appointee, struck down the revised rule. He ignored precedent and the Supreme Court's own reasoning, which upheld the rule-making power of the DOL on this very issue. But in response, California's Department of Social Services halted payment of IHSS overtime, even though there is nothing to keep a state from being more generous, and even though Leon's decision is unlikely to be upheld. But this turn of events reminds us that there will be no justice without stronger worker movements demanding accountability of elected officials and enforcement for empowerment. Let me conclude. 2 decades ago, under the slogan, "We care for the most important people in your life," New York consumers, unions, and employer associations together won increased state payment for home care. They understood what disability rights groups, senior advocates, and organized labor in California and elsewhere have learned. Better wages and better care go hand in hand. In spite of public policies that separate, that place enforcement and regulation under different laws and in different administrative bodies, the alliance we witness today in this very tribunal between UDWA and the California Domestic Workers Coalition represents the recognition of the shared interests of domestic workers and home care workers, those who give and those who receive, workers, employers, and consumers, even our governor and politicians, in building together a more caring and a more just America.